This is a short recording on the definition of principal diagnosis. This can be found on the bottom of page 30 in your AHA handbook, and it's probably one of the most important things to know in coding is what the principal diagnosis is, and to be able to select that out of your documentation. So it says in your book it's defined as the condition established after study to be chiefly responsible for the admission of the patient to the hospital for care. And then it goes on further to give more descriptions or uses of the principal diagnosis. But two key parts to this definition is after study and responsible for the admission of the patient. So what does after study mean? After study means tests, procedures, surgeries. Tests could be lab tests, x-rays, any kind of procedures, appendectomies, major procedures or surgeries. So an example might be a patient comes in with acute abdominal pain. They study or do blood tests, check, and they see the white blood cell count is up. They do some sort of scan or ultrasound and see there's inflammation of the appendix. They go in and do an appendectomy. So after study would be after the blood test, after the ultrasound or scan, and then after the appendectomy. The chief reason for admission is appendicitis. Okay. The condition of abdominal pain is integral. That means always a part of appendicitis for coding purposes. So our principal diagnosis is appendicitis, and we are not going to code the abdominal pain because that is integral, and we don't code out signs and symptoms of an established diagnosis. Okay? So that's a real straightforward example of principal diagnosis. This is one of your big objectives for this learning plan. Two parts to that definition. Establish after study to be chiefly responsible for admission.